evening or good day. This is Dr. Patricia Ayuk Numadem. I am an associate professor from Howard University College of Pharmacy, where I've had the privilege to practice in the past 25 years. So I'm really excited about sharing my views on this wonderful opportunity. And I just want to let you know that you, the elderly, you're a special population that we care about so much, and I am going to focus on the different medications that could increase your risk of falls. Okay, so to start off, I just want to remind us that falls are the leading cause of both fatal and non-fatal injuries in people that are 65 years and older, and it can lead to significant cause injuries, functional decline, and reduced quality of life. So while certain medications are known to increase the risk of falls, that is the bad news. However, the good news is that medications are actually a modifiable risk factor. So that to me is really good news. So we as pharmacists, we have a specialized training in medication management, and so we play a significant role in collaboration with other healthcare professionals to be able to decrease the risk of falls. Okay, so the multidisciplinary team approach is really what I'm emphasizing on, because the primary care doctor has their role. So using a patient-centered team-based approach, pharmacists, we collaborate with your primary care, doctor, other members of the healthcare profession in order to give you optimal care. So pharmacists can screen, for fall risk. They can review and optimize medication therapy. They can even make recommendations for vitamin D in those patients that are deficient, and educate patients and caregivers about ways to prevent falls. So our tools and resources are really from CDC, the study, and also, the BS list, etc. Okay. So two main things, polypharmacy and multimorbidity. We know as we age, many different health problems, so multimorbidity, that results in taking so many drugs, polypharmacy, 4 drugs or more. Typically, 85% older adults, they take at least 1 prescription medication, and about 25% take 5 medications or more. That increases the risk of interactions and side effects, and of course falls is one of those. All right, so I'm going to look at 4 major categories of medications, and then also just list others, because just 10 and 15 minutes I cannot talk about all in detail. So the medications that affect the central nervous system, these are called psychoactive medications. These include, but not limited to, anticonvulsants, antidepressants, antipsychotics, benzodiazepines, medications for anxiety, opioids. These are like medications for pain management, severe pain, and sedative hypnotics. And patients could experience any of these symptoms, from dizziness, drowsiness, sedation, confusion. Some have blurred vision, and even experience orthostatic hypotension, which is also known as postural hypotension. They can, fall suddenly if they get up suddenly. Okay. So other type of medications are antihypertensive medications for blood pressure control. A lot of elderly, they easily experience sudden drop in blood pressure upon standing. I said that. Medications like tamsulosin Flomax, clonidine, which is Catapres, labetalol, which is either Normodin or Trandate, verapamil, Kelan, Isoptin or Verilan, captopril, Capotin, hydralazine, Apresolin. These medications should not be discontinued abruptly, because when you discontinue them abruptly, it actually leads to a major problem known as rebound hypertension. So we recommend tapering. So your caregiver works with you to slowly reduce the dosages of the hypertensive medications. The third category is anti-diabetic medications. And these, again, we know that people with diabetes have a high risk of falls compared to others in the same age. But now when they're taking diabetic medications to normalize the blood sugar, if the blood sugar goes lower, that's hypoglycemia, and that can actually increase the risk of fall. So there are so many anti-diabetic medications in the market, from insulin to other oral agents. But the 3 major categories of medicines that are considered hypoglycemic are the insulins, the meglitinides, which is like repaglinide and nateglinide, or the sulfonylureas that have been around for a long time, glipizide, glyburide, gliclazide and glimepiride, all of these can actually decrease your blood sugar to a level that is not healthy. Other medications that are also anti-diabetic that by themselves are not known to really lower blood sugar to cause hypoglycemia, but if used in combinations could also lead to hypoglycemia and therefore increased risk of falls, include the biguanidines, popular metformin, we all know glucophage, right? And the thiazolidinediones like rosiglitazone or paraglitazone, and the other category, which are the alpha glucosidase inhibitors like acarbose, miglitol, or even the voglibose, and then you have the DPP4 inhibitors, sitagliptin, saxagliptin, vildagliptin, a number of gliptin, linagliptin, alogliptin. So any of these medicines, again, I don't expect you to remember, but if you're on any of these, it's important to really be aware. Now, other categories are like blood thinners, things that prevent your blood from coagulating, like aspirin, Coumadin, or Plavix, that can also lead to falls. NSAIDs like ibuprofen, Motrin, or Advil, when that is being used, we want to pay attention. Constipation medication for gastroesophageal reflux disease like the famotidine, all of that have also been implicated. And the high ceiling diuretics, very popular, Lasix, furosemide, that has also been known. Okay, another thing that the pharmacists could also do to help is that they can recommend, they help to manage vitamin D deficiency, because patients with vitamin D deficiency have also been known to be at high risk for falls. So we can recommend calcium from diet or supplements like 1200 milligrams of calcium and about 1,000 to 2,000 international units of vitamin D. So now I want you to know that the response to every patient will be different. So again, it's multidisciplinary and it's also variable because we don't have a uniform approach for each patient. It might be different from patient to patient or from drug to drug. In some cases, we might just have to stop the medicines, tapering it to prevent rebound. In others, we might switch to safer alternatives like herbals, non-pharmacological medicines, non-pharmacological therapies that, will be safer. And in some cases, you just have to reduce the medications to their lowest effective dosages, okay? And again, like I said, like with the psychoactive medication, those are like the ones that for the most part, I want to just elaborate a little bit because a lot of patients, when they are on these medications, we have to pay attention to the fact that they can actually worsen or increase the risk of falls. So there are a certain number of those that I just want to highlight, like the benzodiazepines I said for anxiety, right? Examples are what? Clonazepam, alprazolam, diazepam, and lorazepam. What do? Avoid them or stop when feasible and taper the dose. So of course, your healthcare professional working with you. The next are like the sedatives. These are helping with insomnia, helping you to fall asleep. So like the zaleplon, zolpidem, ezoplicon, all of these can actually we can actually switch the patient to safer alternatives like melatonin. There's melatonin tea, lavender bath, or even trazodone is much safer compared to disease. There are others that are strong centrally acting anticholinergics and antihistamines that are used for non-central nervous system indications. So again, Benadryl can be used for what? Rash, irritations, is loratadine. So all of these overactive bladder medicine like oxybutynin, totelrodine, physiotherapy, and also bowel medications like dicyclomine, hyoscyamine. If those are prescribed, you can stop. If treatment is needed, switch to something that is non-CNS penetrating like Zyrtec, cetirizine, or loperamide, anticholinergic, Imodium. Those will be recommended. The next one, these are all psychoactive again, tricyclic antidepressants. These, for example, the tertiary amines like amitriptyline, elavil, or imipramine, doxepin, you can actually switch to the secondary amine like nortriptyline or desipramine. So your doctor would definitely work with your pharmacist to switch, okay? And some antipsychotics, we have first generation antipsychotics, high potency, that, through inducing Parkinsonism, movement problems. You have low potency, that have anticholinergics like olanzapine, but then they can switch to second generation antipsychotics. These have low or no anticholinergic effects, like what? Quetiapine, risperidone, or aripiprazole are examples. The next category of psychoactive are like some mood stabilizers or anti-epileptic seizure. Lithium, valproate, carbamazepine, all of those topiramate, or phenobarbitals, barbiturates, or the primidone, gabapentin, all of these, pregabalin could be switched to, minimal effective dosages of this medication. Stop or avoid them. That can actually help to decrease the risk. And the final psychoactive category is the psychotropic, so like paroxetine combinations. So combinations of paroxetine and bupropion, fluoxetine or duloxetine and bupropion. So we can just reduce the dosages of any of these combinations in order to decrease the falls in the patient. Okay, so clinical pill or recommendation is that it's very important to know your medications. What are they prescribed for? What condition? What is the dosage? How often? What are the possible interactions? Things not to use together. Is it milk? Is it alcohol or whatever? Or using them in combination? What are the potential side effects? So be compliant and also adhere to the regimen. Take it as directed in order to, again, the more medications, it's been known to actually worsen polypharmacy. That also worsens compliance. But working with your doctor, they will be able to tailor the medication, not, putting you on many medications that you don't need for the same condition. Also important to take advantage of and see your doctors, conduct annual reviews, attend brown bag reviews in different hospitals or settings, and that so you can bring a complete list of all your prescription medication, over-the-counter medication, the things you just buy without a prescription. What herbals or other supplements are you taking? Those are very important. They can change, the way you respond. So the next appointment, you want to get all of that together, and the doctor will help you or the pharmacist will help you. So again, it's a multidisciplinary approach to optimize your quality of life while you age gracefully. As you pay attention to these medications and work with your healthcare professionals, I believe we'll be able to decrease your risk of fall, because medications indeed are a modifiable risk factor for falls. And so I'm very, very happy that I was part of this. So I hope this helped you. I'll be glad to answer any questions that you can direct to me after the program. Thank you. And this again is Dr. Patricia Ayuk Numedem from Howard University College of Pharmacy. Thank you. God bless you.